listeners, and welcome to our latest episode of Bridging the Gap ASRHR Conversations. I'm your host, Ariba Shakil Ahmed, and today we will be discussing a sensitive yet critically important topic, female genital mutilation, often referred to as FGM. This practice, deeply rooted in culture, religious and social factors, affects millions of girls and women worldwide with profound physical, psychological and social consequences. Joining us today, Dr. Joana Maia, fourth-year public health medical resident with a postgrad in female genital mutilation by Nova University of Lisbon, an expert in the field of women's health and human rights. Before we begin, I want to acknowledge that today's discussion might be difficult for some listeners. However, it's crucial to shed light on such topics, breaking the silence that often surrounds them. Let's dive in. Dr. Joana, thank you so much for joining us today. To start, could you provide our audience with a clear definition of female genital mutilation and discuss the different types and their prevalence?
Yeah, of course. First, thank you so much for having me. So, female genital mutilation, or FGM for short, is any kind of procedure that is done to the external part of the women's genitalia for non-medical reasons. Of course, if it's medical, it's not considered mutilation. So, that's the definition that WHO has. And it's a very complex practice, and it's very difficult to tackle this issue, but it's very important to talk about this practice, of course. So, regarding the prevalence and the types of mutilation that there is, there are 4 types of female genital mutilation. So, the first type, it's only about the excision of the clitoris, and the second type also affects minor labia, and the third type affects all of those, but also stitch the major labia together and also only leaves one opening from which the women have to expel urine. And the fourth type, it's all other, so encompass all other types of mutilations. Regarding the prevalence, so we know that first most of these practice is done before the girls are 15 years old, which is very concerning. And the type of practice, it depends on the community that practice and also the region that it's done. So, for example, we have countries like Somalia and Egypt that the majority type is type 3. That's the most aggressive one, but also we have other countries that do mostly type 1 and type 2. The type 2 and type 1 are like 90% of all the cases, although type 3 it's only 10%, is around 8 million women that live with this practice.
So is it like equivalent to male circumcision? What is so concerning about FGM?
Yeah, that's a very good question. So in the 80s, the WHO came out with a definition that it shouldn't be comparable to the male circumcision. First, because of the extension of the practice, so it's way more severe for girls than it is the circumcision for men. And also the male circumcision has some medical reason behind it, okay? And the female genitalia mutilation has no medical reason for doing it. And also in terms of religion, we know that male circumcision is a requirement in many religions, but we know that female genital mutilation is not the case.
Right, thank you so much for that comprehensive explanation. It's crucial to understand the basics before delving deeper into this topic. So now let's address a contentious aspect of this issue, the idea of medicalization FGM, given the short-term complications. Some argue for medicalizing FGM, suggesting it to be done in a safer context, right? So what are your thoughts on this perspective?
Thank you so much for this question. So medicalization is a very issue that is hot topic, you know, like everybody wants to discuss it because it tackles the short-term complications, you know. Most of this practice is done without any kind of anesthesia and is not in a safe environment. So of course, if you think about a hospital environment, you'll think that's safer. But this practice is not safe in any context, either outside or inside the hospital, okay? So that's two main problems that we have when we medicalize this practice. The first is that we are legitimating this practice, okay? So we're saying that it's okay, that we can go do in a safer environment, okay? And the second is that we're not addressing the long-term complications of this practice. We're not tackling the long-term complications of this practice that goes beyond the physical injury, but also the psychological injury that it goes with the women for all of their lives, during the labor and all of this.
Right, so your insights challenge the notion of like safer practices in a profound way. So understanding the problem is one thing, right, but solving it is another. Let's explore the first steps towards change. So my next question is that in tackling such a complex issue, what should be the first step?
Okay, so I think the first step for tackling this issue, first we should address the healthcare professionals, okay? The midwives, the nurses and the doctors that provide care for these women. So they can identify it, so they can talk about it respectfully and also know what type of procedure they can do to help these women throughout their lives. So also we need to be very respectful and very careful when we talk about this practice. So when tackling this issue, the first step, in my opinion, is to engage healthcare professionals, the doctors, the nurses and the midwives that provide direct care for these women and girls, of course. They should know how to take care of them, not only in the moment that is done, but also afterwards, during the labor and all of these complications that women and girls will face throughout their lives. And also, it's very important to report it, okay? So, of course, we need to know how to do this confidentially without breaking the bond between the doctor and the patient. Right. So that's very important. And also to provide data, because one big problem that we have when we talk about this issue is that we don't have concrete data on this issue, you know. So it's very important to start with healthcare professionals and then go to the lawmakers. We have this data, we have this much reports, and now we need to do and address some laws and also go to communities and try to engage them.
Right, so very inspiring and practical, a great foundation for the journey towards eradicating FGM. So the law can be a powerful tool for change. How is it being utilized in the fight against FGM? How do international and national laws address the problem of FGM?
Thank you so much for this question. So regarding the international law, we know that a lot of NGOs, even the WHO and the United Nations are tackling this issue and think that's really important for us to talk about this issue. So we have a lot of conventions on this topic and how to address it, and that it's a must, you know, for us to tackle this issue. Even the United Nations have the 5th Sustainable Development Goal that is about gender equality, and the 5.3 target is about female genital mutilation and the complete eradication of this practice. So this is in the agenda of the international agenda. Going nationally, of course, the countries can and should implement some laws to address this practice and try to prevent it. But again, even if they do, because it's a very complex issue to tackle, we have also the problem of the implementation and reinforcement of the law throughout, you know, all of the world that this practice has been done. So of course we can go to the law, but also we always need to engage the communities first.
So what about the communities where FGM is like practiced? So what are your thoughts on that?
So the communities are mostly very tight-knit communities, okay? They are very close, and they don't, even the doctors that the women see, they are from that community, so they are more likely to understand this practice and respect this practice and not report this practice. So even in the communities and the law, you know, should be applied, sometimes it is not, because they don't go outside their communities.
Legal frameworks are indeed pivotal. It's enlightening to hear how they are being applied globally. So success stories can light the way for future efforts, right? So let's hear some of these beacon initiatives. So my next question is that could you share some examples of effective interventions that have successfully reduced the prevalence of FGM?
Yeah, so when you think about reducing the prevalence of FGM, you have to think about first that's a cultural practice. So it's deeply ingrained ritual in the society. So first we need to understand what is the ritual behind this practice. And then we can tackle that. So for example, in Kenya, so the Maasai community in Kenya, for example, they had this rite of passage for women to do, and when they do it, they were taught about how to live a domestic life, how to do tasks in the home, and also they would practice this female genital mutilation. What they do is that now they still do it, they do alternative ritual of passage, and they still respect the culture. They still do this, this ritual of passage, but without the female genital mutilation associated with it. So it's very important for us to respect the practice and try to see the ritual behind it, so we cannot disturb, the communities that do this. Also, for example, we have the case of Somalia. So what they did there, for example, the NGOs tried to engage community leaders and religious leaders and try to show them, for example, that there's no religion, reason for us to do this practice. And then they advocate in the community. So we are also seeing progress in that regard.
Right, so those examples are not just hopeful but also illustrative of effective strategies. So bringing the focus closer to home, I will definitely talk about Pakistan and definitely ask you about Pakistan as well. But let's discuss FGM in the Eastern Mediterranean region. So is FGM a problem in Eastern Mediterranean region? How does it manifest in different regions?
Okay, thank you so much for the question. So this practice has been done for more than 200 million women worldwide, okay? And this practice spans from all continents, from Africa to Asia to Europe to Australia. We have records of this practice worldwide, okay? So that's not only an African problem, an Asian problem, that's a worldwide problem. That's the first thing that I want to say about it. Of course, when you look at the Eastern Mediterranean region, that's very difficult to tackle this issue. So when you look at Eastern Mediterranean region, we have to see particular cases and not globally there, because there's so many different cultures, religions, and practice and types of practice doing there that we have to see it particular for each country and each community, okay? So for example, in Iraqi Kurdistan, we know that's a very common practice there, and we also know that other countries like Yemen have this practice in more rural settings. So we have to go to those communities and see what is the ritual behind it and try to tackle that. Of course, we have other countries on the northern part of Africa, of course, like Egypt, that have a high prevalence of this practice. So for example, when you see Egypt, we know that's a high prevalence there, but still there is need for us to intervene there and go with NGOs and go with political forces and try to engage the community and also the leaders, so this practice and these laws can be reinforced and make sure that not other women will go through this practice.
So community involvement is crucial in social change. How do we engage those at the heart of community? How can communities, particularly men and women leaders, be effectively engaged and mobilized to end FGM?
To tackle this issue, of course, we need to involve men and community leaders and also women leaders, of course. But in most patriarchal societies, men are a pivotal role in this practice. So we, of course, you cannot overlook them. So when we look at men here, we need first to educate them and see and make them see what this practice really does to women. So when we're trying to engage men, for example, education plays a pivotal role, okay? So first we need to educate them and see if they can, of course, understand this practice and the consequence of this practice. So of course, education in the house, education in schools for also women and men plays a pivotal role. And then we go to the communities and we have to see if there is religion belief about this practice, if there is cultural, and go to see the rituals again, and try to engage, for example, the community leaders and the religious leaders, always with the empathy and, of course, respect for the practice and what it represents for them. And then we can then tackle this issue and try to gain, their support. And if we have the support, it's more likely that we have the support of the community as well, because they are very important people in the community.
Exactly. Empowering communities to take action, that's a powerful approach. So our final question touches on solidarity and support. How can people who are not directly affected by FGM become allies and advocates to help end the practices?
That question is very important. Also, I asked myself when I started working on this, because I'm not directly affected by this practice, so what legitimacy do I have, to work on this practice? But this is more about human rights, than it is about one specific person. So, of course, we need to first be empathetic with this person. We need to know how to engage them. We need to do it respectfully, and we need to see what is behind their practice. Why do they do it? If it was their choice or not, and if it was their choice, why was that choice? If it was not their choice, if they are planning to do the same to their daughter, for example. So we want to tackle this issue in the root. So the mothers already have this problem, so we want to prevent the daughter for going through the same thing, because there's no real solution for this practice after it's done. So we need to prevent it, of course. And of course, when you talk about allyship, you also need to talk about auto-support organizations that are working on this. So, for example, we can, of course, provide money for them, financial support, we can volunteer, we can amplify the voices of these women. And we can also do qualitative studies about the suffering that they've been through, and also share that with our circle and with our leaders and our politicians. So first it starts with a little drop of comprehension and empathy. And then we can amplify these voices and make sure that it goes to the right people, and we really can help these women, worldwide, even if we're not directly affected by this practice.
So allyship is a powerful tool. Your advice gives us all a part to contribute meaningfully. Thank you so much, Dr. Joana, for answering all those questions. I'm sure audience might have like few more questions, but before conclusion, let's transition into a final segment of our podcast episode. I'm sure you all know what is it. It's a rapid fire round for you. So, Dr. Joana, are you ready?
I am.
Okay, so you will have just 10 seconds to respond to each question. Let's begin. So myths or facts?
Facts.
Silence or speaking?
Speaking.
Change or tolerance?
Both.
Secrets or stories?
Stories.
Future or past?
Future.
Healing or hurting?
Healing.
Voices or echo?
Both.
Empower or oppress?
Empower.
Choices or constraints?
Choices.
Empathy or apathy?
Empathy.
Action or inaction?
Action.
Thank you so much, Dr. Joana, for joining us today. It was wonderful having you. As we close, our discussion today highlights not just the physical and emotional trauma associated with FGM, but also the culture, social, and legal frameworks that contribute to its prevalence. Let's remember the millions of girls and women who are affected by FGM. This is not just an issue for certain countries or cultures. It's a global concern that demands our attention and action. Let's continue to advocate for the rights and well-being of all women and girls, striving for a world where practices like FGM are relegated to the past. Thank you, listeners, for tuning in. We hope this episode has been enlightening. Until next time, I'm Ariba Shakil Ahmed, and you're listening to the Bridging the Gap SRHR Conversations. Stay safe.